Okay, I'm with Trish Hennessy of the Canadian Centre for Policy Alternatives, who's just been talking with us about framing and messaging. Trish, what would you say is the most important message for social planning bodies in terms of how we frame our message going forward?
That framing is really an accessible idea. It's about telling our stories from our own perspective, from a perspective of what we do that's good, that's about community building, that when the chips are down, it's the people who are in the planning councils across North America who are on the front lines providing the service, making sure that nobody falls too far behind. So framing sounds like a big concept. It's really about telling your story from your own point of view, from your own value point.
And a lot of the discussion here is around human services and how we tell our story effectively. How would you link that with the discussion around income inequality?
So the thing about income inequality that we've learned in our own research is that when you talk about income inequality as the gap between the rich and the poor, many people disengage because they don't think that that's what they have in common. They think the rich are somebody they don't know, the poor somebody they don't know, and they're really worried about maintaining what they have. So when we started our research project 6 years ago on income inequality, we started talking about the gap between the rich and the rest of us and focusing on what we all have in common and what the system is doing in terms of fairness for everyone. And Occupy movement kind of nudged that a little bit and made quick work of that frame by narrowing it down to the 99%, which is, basically all of us have something in common.
This may be an unfair question, but these are my favorite kind. I know you've talked to a lot of groups in Canada around these kinds of issues, and I'd be interested if you have any sense of a difference in perspective, just the tenor of the discussion, the questions and answers between the discussion here in Washington and the discussions you've been in north of the 49th parallel.
Oh, that is an interesting question. I think that what's possible in terms of public service, what you can do together through taxation, through public programs, seems a little bit readier in the Canadian imagination. The idea of what's possible in terms of universal public health care, for instance, is a widely held and cherished public program in Canada. It's become synonymous with the Canadian identity. It's a good thing. Whereas that sort of idea in America still is a little frightening. People don't quite understand whether it's the right way to go or not. In Canada, what we've seen and what we've witnessed over the last generation is it's a very good thing that we all benefit from it, that not only is it the most cost-effective way of delivering health care, but it's good for our communities.
Thank you very much.